So part of this was kind of like a skills lecture, and part of this was, like group discussion. So we begin usually with mindfulness activity. I think I have on here, I ask people to define, how would you define mindfulness? What's your experience of mindfulness been like? Have you ever used mindfulness to address your sleep? Was it effective, or did it maybe have detrimental effects? So we usually have kind of a brief discussion there. But our goal is to introduce them to a new form of mindfulness practice every week. So we'll do some kind of activity related to mindfulness, hopefully mindfulness activities that would be useful prior to sleep or in that like kind of buffer zone while you're like doing your nighttime routine. But that's kind of the goal with mindfulness practice here. Then I tend to offer just a brief definition of mindfulness. So one neuropsychologist, John Kabat-Zinn, defined mindfulness as mindfulness means moment-to-moment, non-judgmental awareness. It's cultivated by refining our capacity to pay attention intentionally in the present moment, and then sustaining that attention over time as best we can. In the process, we become more in touch with our life as it's unfolding. Typically ask for reactions to that. And then I have another one from Sam Harris. But he said, mindfulness is simply a state of open, non-judgmental, and non-discursive attention to the contents of consciousness. Whether pleasant or unpleasant, cultivating this quality of mind has been shown to modulate pain, mitigate anxiety, depression, improve function, and even produce changes in gray matter density in regions of the brain related to learning and memory, emotion regulation, and self-awareness. So this definition offers more of like the benefits of mindfulness, what we know about mindfulness, and how much you have to gain from like flexing this muscle and learning and developing a mindfulness practice that works for you. I would even offer a more simple definition of mindfulness, that mindfulness is simply becoming aware of your entire existence and your experience of life in the present moment. How I think about this relating to sleep is that so often when we struggle with insomnia, whether we're trying to fall asleep, we get so caught up in the effort of trying to fall asleep that we end up becoming not mindful of our own body, right? We don't realize that our body has gone from sending us those signals that indicate that we're tired, that we need to fall asleep, to work mode. We feel alert, we feel hot. And all of those things are really important to notice as you start to begin your journey in battling insomnia. So mindfulness is about being aware of yourself in the present moment so that you can make changes and ultimately respond most effectively to your environment. Mindfulness and insomnia. There is a ton of research on just mindfulness-based approaches for the treatment of insomnia. If you're interested, this is a super cool article from Rush University. They talk about mindfulness, meditation, and emotion regulation, and the health benefits here. But they also integrated some of the mindfulness practice into treatments, some of the existing like treatments for insomnia. We'll do some of that work here, but if you're looking for a more targeted mindfulness-based approach, or even if you just want to learn more about how you use mindfulness and insomnia, this would be a great resource to check out. This is just a picture of that book. And so again, like this is where I would kind of introduce our mindfulness exercise to start. I usually do something like a body scan in this first session, but I won't do that here since we're a little short on time. So I will ask you guys, what is your definition of insomnia?
I would say prolonged sleep disturbance characterized by difficulty falling asleep, staying asleep, or not feeling rested upon awakening. Although that's a very DSM definition, but
I was just gonna say it sounds like you may have had some psychology training, Robbie. How about that? Yeah, so almost word for word there's a persistent difficulty with sleep initiation, and one of the qualifiers is some form of daytime impairment, right? So it's not enough to just feel sleepy during the day occasionally, or to have difficulty falling asleep throughout the night, but rather true insomnia has some kind of form of impairment where you're unable to concentrate. Maybe you feel, fatigued or like unable to, sustain your attention or be productive. You might notice just like general impacts on your performance, things like that. Chronic insomnia occurs in about 10% of the population, which is a pretty high number considering. And that is, I think, notable because insomnia is also super underassessed and undertreated. So we don't typically in psychotherapy, people report sleep difficulties with some regularity, and given the level of, depending on what's going on, or what their like primary reason for seeking treatment is, it may or may not get assessed and treated further. So one example that I've run into quite a bit is with folks who are seeking trauma treatment, right? They want treatment for their PTSD. Their PTSD is the thing that's really, really bothering them throughout the day. We know how distressing that disease or that disorder can be. And also, insomnia is super common in folks with PTSD, given the nightmare presentation and the like kind of disruptive, like kind of constant high alert, hyperarousal symptoms that are characteristic of PTSD. So a lot of times people also have underlying chronic insomnia with PTSD. And so as they focus on their PTSD, they may, like, some folks may experience, changes in their symptoms, or maybe they like some symptoms of PTSD go down, but they're still experiencing like almost like an increase in depression, or like, man, I just feel like crap all day. That can be the result of insomnia. Like their treatment, PTSD treatment is working, but insomnia hasn't been treated. They've never learned how to sleep. How do I sleep and prepare myself to lay down knowing that I may or may not experience a nightmare tonight? And so while insomnia is, noted at like 10% of the population, my clinical experience has been that it's actually much higher. Acute or transient insomnia occurs in about 30 to 35% of the population, which essentially means like it's super common to have a rough week of sleep, even where you can't fall asleep, you have difficulty staying asleep, and you're experiencing some daytime impairment. Again, the key word here is acute, that like it goes away and you revert back to a more normal pattern. So when you talk about insomnia, most people are familiar with the symptoms. They may even have experienced it in some form. So one thing that you'll want to ask the group is like, hey, is this your first time ever dealing with insomnia, or has this been happening for months, years even? How long has it been? And you'll want to get some kind of sense of what the group's kind of like diversity in terms of their experience with insomnia is. Again, it can occur just on its own, or in comorbidity with psychological difficulties, medical conditions, and substance use. One of the reasons we wanted to start this group was because, again, so often this does occur with other psychological difficulties, but because that other thing is the primary reason you're seeking treatment, the insomnia doesn't get addressed. I've said all along that good sleep is like a superpower. If you ask yourself, as someone who definitely falls into the chronic insomnia category here, I pie in the sky daydream about having 8 solid hours of sleep a night. I am proud that I have gotten that to like once a week. I think I get 8 hours of good sleep a night, like continuous, which is unbelievable for me. But so often we're focused on anxiety, depression, PTSD, borderline personality disorder, you name it, and we don't actually learn the skills to address our sleep. And so we wanted to offer this group as a way to supplement your therapy, and really build on the things that you're working on in therapy, and also make a really meaningful change in your life in a pretty short amount of time. Here's I think this was I'm trying to remember. I'm pretty sure, yeah, this is just an RCT. Leo. Stop. Can you lay down? Dog. Okay, this was just a quick RCT, but the main point of this slide is to indicate that there's substantial research on the effectiveness of CBT-I, which is a behavioral treatment for insomnia. Compared to our leading sleep medications, CBT-I is at least as effective as the leading sleep medications that are listed here. And it was found to be superior in some trials, and in several studies there were greater long-term outcomes for CBT-I compared to using sleep medications. So generally I ask the group like if they've had any experience with sleep medications, if they consider it, maybe they're using it now. And the point is not to down talk medications, but just to say like, hey, this is as effective, and then you don't have to deal with the side effects and money, and the I guess the habit forming of like taking a medication over time. So CBT-I superior to Zoviclone in both the short and long-term management, which is a pretty groundbreaking study. This was a meta-analysis that compared just typical pharmacology approaches and behavior therapy for persistent insomnia. And they showed that 21 studies from 66 to 2000 found that they had similar short-term outcomes, but actually behavior therapy, so CBT-I or components of CBT-I, produced greater long-term benefits compared to medications. So again, this is just there's a whole bunch of research behind this. This is really effective. And the thing that I really like about this is that we're not talking about 12 months of therapy for this. This is 5 weeks. So this is of the like typical therapies that have evidence base behind them. This is one of the faster therapies you can do to see a massive effect on your life and on the symptoms that it's targeting. So this is a really cool opportunity to see meaningful change and have it last. And again, like the point of this group is to learn how to become your own sleep researcher. Our goal is not to keep you in this group for 6 months. We want you out of here in 7 weeks because you don't need this group anymore. You've learned the skills, you know how to apply them, you know how to assess like, okay, I had I've started to notice that I'm having nighttime awakenings at night. What is going on? Like, what do I need to tweak? To be able to examine your daily routine and say, okay, I need to start to restrict my sleep a little bit more so that I can build up greater sleep debt and be able to sleep through the night. Or I need to limit my caffeine after noon as opposed to after 3 p.m., things like that. So that's kind of the point of these slides. This is CBT-I was found to be a first-line treatment for insomnia, but finding providers who are actually trained in delivering CBT-I is somewhat difficult. Really, like insomnia, as an insomnia treatment, this is the thing that should be rolled out first, according to the evidence-based and what the leading clinical guidelines are at this moment. And it's kind of difficult. This is the only CBT-I group that we know of in this area. And so this is a really cool opportunity to join this. Usually CBT-I is delivered in an individual format. We're trying to offer it as a group so we can get access to more people. I can't remember why this slide is in here, but it just, I think, again, highlights that two of the main components of CBT-I, stimulus control and relaxation, or the combination, are really standard components that should be applied in CBT-I.
Jordan, can I ask a quick question? Is that okay?
Yeah.
I'm just noticing it's interesting that I feel like you could talk about CBT-I and the evidence for it at this point, but I don't think we've had a moment where you've actually said like, this is what CBT-I is. And I'm wondering if that's intentional, if you're kind of like keeping the suspense, or if I missed it earlier. I just want to clarify.
Yeah, doing a little bit of my best Stephen King impression to build suspense. So this slide talks about the CBT-I components, about what CBT-I is. So usually this is kind of what I say is, so CBT-I is cognitive behavior therapy for insomnia. It involves several different components, and the application of these, like, I guess I'll call them skills, to practicing, or to like applying those to your like daily life and to your sleep schedule. Again, we're trying to teach you a toolkit. You may need to use some of these tools. You may need to use all of them. I've found that in my life, I tend to use some more than others, and then all of them all at once when my insomnia really gets bad during high stress, low flexibility kind of times of the year. So this is kind of an example of what we're going to cover in the next few weeks as a part of a group. So stimulus control is going to be our first like major skill that we'll cover, which involves only going to bed when sleepy. And if you can't fall asleep, if you don't fall asleep, I guess within 10 to 20 minutes of being like laying down in bed, to get out and do something else until you actually feel sleepy. We'll talk much more about what that is. But the main idea is that we need to retrain your brain to only go to bed when sleepy and start to associate the bed with sleep. So again, trying to build on kind of the natural processes, which is what we'll talk about today, the processes of sleep. In sleep hygiene and in this group, we're going to talk about building a sleep hygiene routine that works for you, not that works for everyone, that works for you individually. So we're going to give you a whole bunch of examples of things that can affect your sleep, how to build an effective buffer zone, which is kind of, I guess, like what we would consider a nighttime routine to increase your sleep hygiene, and then to start experimenting, see what happens when you apply some things, when you take some things away, and see what that effect is. The heavy hitter component of CBT-I is sleep restriction. So this is the part that usually scares people, where you're just like, holy crap, I don't want to not sleep. That's not the point of sleep restriction. We're not going to say, okay, here comes your 24-hour sleep fast. We're just going to keep you up until you have to go to bed. What we are going to do is to restrict your time in bed no less than 5 hours. And 5 hours would be really extreme. I've only had to do that, I think, one time, and that was with someone who had a really severe pattern of insomnia. Essentially, what we're going to do is use the sleep logs, which we'll talk about again today, to examine how much time you're actually asleep each night. So if you're getting into bed at 10 and maybe you're sleeping in till 10 p.m., but if you're getting into bed at 10 p.m. and you're sleeping in till 10 a.m., but you are, laying down in bed, reading or watching TV for an hour and then waking up multiple times throughout the night, maybe you're only asleep 7 hours that night. What we want to do what we would do with sleep restriction is to say, like, okay, we're only going to get into bed 7 hours before your wake up time. So we're going to restrict your time in bed to try to give you the greatest opportunity for continued sleep, and then kind of start to build, I guess, this sleep debt, which is, again, something we'll talk about today. And then relaxation training. So we'll talk about different strategies to avoid physiological and cognitive arousal. I know I've focused mostly on cognitive arousal in this group because anxious cognitions, thoughts tend to be the most common kind of presentation, but we can absolutely talk more about physiological arousal, things like, body temperature and like urges to move, restless leg syndrome as well. And then again, cognitive therapy. So we'll talk in this group, kind of throughout group, about having problematic attitudes and beliefs and assumptions about sleep that may worsen insomnia. So this is kind of what we're going to address today, is giving you just some knowledge and information to work with to be able to address some of those cognitions. So we had you all complete the insomnia severity index and the problematic beliefs scale, I think that's what it's called, which gives us a little bit of a range. But today we're just going to kind of educate you on how sleep works, what are the main, what's the model of sleep that we're working off of, and how do we begin to understand our own personal need for sleep. Questions, anything so far?
Actually, so sorry, I do have a real quick question. Is this something to be used with someone who is on like a sleeping, like psychopharmaceuticals for sleep?
Yep, you can totally use it with that. It's there's evidence base for it. What I tend to tell people is, like, we're gonna give you all these skills, and at the end of it, you may decide that you don't need the medication anymore, or that you would like to try to taper down, which is a conversation that you can have with your prescriber. And you may not. You may say, okay, great, like, I've got these skills, and I also want to have the safety blanket of, being able to take trazodone if I really can't sleep that night. Those are fine. We're going to teach you the skills and basically not talk about sleep medication complications from this point on. But our goal is to teach you that, hey, this works as well and has sometimes better outcomes than sleep medication. And this, it's not really, I don't know the exact evidence base on taking it together. It's not harmful. It'll work. The biggest thing is, like, it's really, like, probably like overkill to do both. But in some cases that's what's warranted. So.
Thank you.
Yep. Anyone else? Cool. The model, or CBT-I, is based on, or I guess tries to intervene on two processes of sleep, which was proposed in a model from Borbley in 1982. So they posit that there are really two key processes that regulate our sleep, okay? And they both occur naturally, which is great. That means you don't have to do anything to get these right. It's more about like kind of perfecting the things that might get in the way. Like these are both naturally occurring in your body. So the first process is process S, which is the sleep drive. This is the need for sleep at any given moment. You can think about it as like the pressure to sleep, or like the physiological sensation of like your eyes getting heavy and like what happens right before you fall asleep. That is what we call sleep drive, right? It's your naturally occurring drive to sleep every day. This increases the longer that you're awake. Again, this makes sense. If you've ever had a day where you get up at like 5 a.m., don't take any naps, and you get to 10 p.m., you'll feel that sleep drive most of the time. When you do sleep, that drive is reduced. Process S, again, occurs naturally. If we don't interfere with it, or if we didn't have a schedule to adhere to, this would just occur naturally. We would sleep when we felt like we needed to sleep and get up when we felt alert enough, right? So one part that I'd like to ask you guys is, what behaviors weaken your sleep drive? What have you noticed throughout the day that gets in the way of your drive to sleep?
Like work time and things like that?
Totally, yeah. Work time, especially like I know for me, like doing work late at night or like past 8 p.m. really gets in the way of my delicate, sensitive sleep drive, right? If I don't have adequate wind down time, and even if I do, sometimes working up till 8 p.m. messes me up. Screen time, things like that. Another big one that impacts sleep drive for me is caffeine intake. I've noticed that I am actually more sensitive to caffeine than I think I would have initially anticipated being a graduate student. The days where I have green tea right before group at 5 p.m. Typically result in me not sleeping till 1:30 or 2 that night. So caffeine, substances, eating food late. So if you eat dinner at like 8 p.m., again, something I do constantly, I recognize that usually means that impacts my sleep drive. And this isn't universal. My partner has the most amazing sleep drive I've ever seen in my entire life. She can eat dinner at 8 p.m. And be asleep an hour and a half later with 5 minutes of laying down time. Whereas I am reading my book, my treatment manual in bed for an hour, getting up, going and laying on the couch, listening to Harry Potter being read to me, getting back up off the couch, coming back in, lowering the temperature of the room. I do a lot of things to impact my sleep drive, or to try to like increase my sleep drive. The second thing I want to ask you is, generally we say that people are, kind of the inverse of insomnia is that what is good sleep? This varies from person to person, but the general rule is you're getting enough sleep if you don't feel fatigued and tired throughout the day. Again, like this can change based on a variety of factors, but just think about your typical day. If you're getting enough sleep, you don't have that like really strong sense of fatigue and tiredness. So another question I'd like to ask is like, what do you have a sense of what amount of sleep feels right for you? And if you've been struggling with insomnia, maybe you don't have the answer for this because it feels so long ago. But what is the general amount of sleep that feels right for you?
Unfortunately for me, it's like 8.5 hours, which is pretty hard to get being a working person.
Yeah. Well, I would say this is a judgment-free group. So we're going to take whatever experience you have and just say, okay, that's what we have. That's what you have to work with. Like it or not, like that's your reality, right? I had a friend in college who I think had the unbelievable genetic lottery chronotype that he could function on 6 hours of sleep, like no problem. And I was so unbelievably jealous of him because I think my minimum is like 7.5. About 7.5 hours, I feel good. But I noticed that if I go into the 8.5 realm, I feel lethargic, almost like I got less sleep. So this is a relatively delicate balance, and you'll ask part of this is becoming more mindful of how much sleep you need and what your energy level is like based on the different amounts of sleep that you get. That'll be part of like your homework this week, is starting to track that, starting to get an idea of what amount of sleep feels right for you. The second process here that we're going to try to intervene on is the circadian process. The circadian process is the biological clock. You may have heard of, the circadian rhythm before. Essentially, this is just an internal process that's set and regulated by daylight, wakefulness, and neural activity. This is our body's natural rhythm. It means that there are certain signals that our body sends out, like hormones and activating, signals that are released throughout our body when we experience daylight. Our body is set to naturally respond to the circadian, to like sunlight and like the natural, I guess, rhythm of the earth in terms of when day and night is. We are naturally wired to be more daytime creatures. It's not that you can't learn, develop a circadian rhythm to be nocturnal if you work night shifts, but your natural tendency is going to be awake during the day, sometime in the morning usually, and to start feeling more tired once it gets dark out. With this circadian process, we know a couple of things that are really important. The brain generates these alerting signals during the day to keep us awake, right? And as the day goes on, it starts to generate less and less, and eventually starts to generate signals that indicate it's time to rest or time to go to sleep. We know critically that body temperature goes up during wakeful times and decreases during sleep, which is really important. One of my favorite body hacks in joining this group was learning that you could start to kind of hack this by lowering your core body temperature before bed. So one way I do that is you take a hot shower, right, which kind of raises your body temperature for a minute, and then because your body temperature is getting raised, it activates all the cool down systems in your body, right? So sweating, perspiring, and starting to trying to lower that temperature. So if you take a hot bath, a hot shower, and then get into bed, or if you're, that's generally a way to start the cool down process. We know that body temperature decreases while we sleep, and it actually decreases at different times for different people. This is super important because that actually has a big impact on how you feel in the morning, and generally what kind of tendency you have. So people tend to fall into one of two categories as far as when they like to sleep. So if you've ever heard people describe themselves as oh, I'm a morning person or I'm a night owl, this is generally what they're talking about. They're actually genetic biological chronotypes that mean that people's core body temperature that people's core body temperature decreases earlier in the night versus later in the night. And again, once it decreases, eventually it starts to warm back up and it gets these alerting signals. So that's all a ton of psychobabble talk that you probably don't care about. But I found it fascinating because essentially we're all genetically predisposed to be more of a morningness type person or an eveningness type person. So morningness type people tend to have a preference for early bedtimes with early wake times. Even going back to adolescence, this is usually the first place where people notice it, where they struggled to sleep in on the weekends, particularly compared to their peers. They might notice once they're awake, they're awake. They very rarely go back to sleep after you wake up. They also tend to feel more alert once they do wake up in the morning. They kind of wake up ready to go and are able to, kind of function at a high level, almost immediate, or not almost immediately, but within 30 minutes to an hour of waking up. Insomnia in folks with morningness type tend to have more difficulty staying asleep as opposed to falling asleep, right? So you'll see someone come in and report, you may have experienced hey, I fall asleep within 10 minutes, but I wake up 2 or 3 different times in the night. And then once I'm up, I'm awake for 45 minutes before I fall asleep again. This stands in contrast to the eveningness type. And I will, in full disclosure, say that I am a I am a extreme eveningness type person in some ways. So this is a preference for later bedtimes with later wake up times. Folks with this kind of tendency tend to take a while to fall asleep at night. And they also see that it's physiologically difficult to wake up in the morning. Like your alerting signals are just not firing. So you may hear people describe it as like, man, when I wake up early, it's like I'm coming up out of the grave. I feel like my head's 1,000 pounds. My face feels puffy. I can't function in the morning, right? I have to have coffee immediately or I can't do anything, right? Those are all things that folks with this eveningness type tend to say. So it's harder to be fully alert and wake up in the morning. Again, insomnia with this eveningness type, it tends to result in folks having a difficulty falling asleep. So laying awake at night, feeling active when they try to go to bed early, or just not getting tired until very late at night. And then difficulties waking up. So they may have to set multiple alarms. They may not trust themselves to engage in highly difficult tasks in the morning. And I say all of this just to kind of reinforce the idea that sleep is a system. It's designed to function in a rhythm with a whole bunch of different components of your body. And this system functions the best with consistency. So if we can understand whether you're a morning type person or an evening type person, we can start to intervene on those two processes, the sleep drive and the circadian rhythm, in a way that works for you, right? If you're an evening type person and and you were trying to like get up every day at 5 a.m. and do all of these things to to kind of live on that schedule, it's going to be hard. Though there are certain realities that we have to grapple with. But again, like we can work within this system to get some consistency and start to intervene on those types. Questions so far?
I was just gonna say I feel you on the eveningness type, Jordan.
Yeah, it's a struggle, especially because
yeah.
The world doesn't really function on evening type people's schedule. So usually evening type people have to conform to the world, and usually that results in sleep difficulties.
Exactly. I was going to say, like, if it was natural for me, I would probably sleep. I'd probably go to bed between 12 and 1 every night and get up by 9.
Yep.
But that's just not practical.
Yep. And that is a fantastic point. And there's a whole bunch of different reasons for that. That is a schedule that I have like tried to adopt when my semesters have been more flexible, but it also like comes with some downfalls. That means that that means I still have to be working when my partner gets home and like wants to have dinner, and so like there's also like the natural rhythm of life when other people are on a more morningness schedule. It's difficult as an evening person. Not to say that it's not impossible, but yeah, if we were looking for the easiest way to address sleep, our sleep needs, like that would be it. I would just go to bed every night between 1 and 1:30 and get up between 9 and 9:30, and work until 7:30 or 8 every night, and then have dinner, work out, all that stuff, Yeah.
And my wife is totally the morningness person, so you're right. It's like the opposite.
Yeah, totally. All right, so this is just some questions I tend to ask the group. So I ask people, what are the most problematic parts of your sleep right now? What do you really want to fix? Where do you see as being the most like bothersome here? Ask people what the effects are on their current sleep patterns and what will most likely get in the way of addressing sleep this week. Here's where I explain the sleep log if they haven't already done it, or we can break up and kind of like take a look at their past sleep log and how they might apply the new skill to this upcoming week. So this is just one of my sleep logs from, August, it looks like. So you can see here, like I had difficulties with consistency this last week. I would get into bed typically around 12:30, and then often wasn't asleep until 1:30 or so. But I had 1 week of like one earlier night here. And then you can see like I tried to set and hold an 8:15 a.m. about 8:15 a.m. wake up time. and slept past it almost every day. Got up a little bit later. So this was difficult. When I looked at this, I was like, ugh. Like I mentioned, the early stages of this sleep group, we want to just maintain consistency. We want to start getting the natural systems of your body under control and functioning as they're supposed to. Essentially, we want to get out of the way of our natural systems. So I'd ask people, what is a time that what's the latest possible time that you have to be anywhere early in the morning? When do you absolutely need to be awake by? And then we kind of, I guess, troubleshoot when a meaningful wake up time would be for you. So me with an evening type, if I were to say like I need to be up by 6 a.m. every morning, that would be a problem. I would have difficulty doing that, and we'd probably have to do a lot of troubleshooting and maybe MI around like, why do you need to be up at 6 a.m.? Do you have to be at work? Is there any way to move your schedule back? Those kind of things. So I think I selected an 8:30 a.m. wake up time the next week, and agreed to try to get into bed sometime after midnight. Again, like not getting into like full stimulus control yet, but just saying like, hey, I want you to absolutely be awake by this time. Can you commit to that for this week? So this is actually the following week, my sleep log, and you can see that like I was much more consistent here. I slept past it here and took a nap. I'm not sure why, probably because I went to the bar on Saturday night, but things like that here. So holding 8 a.m. wake up time was much more consistent and felt more at peace that week.